Yeah, today is a wonderful day where we've been able to bring all the stakeholders in the ecosystem together here in Bangalore. And I say stakeholders, companies like Philips, startups, hospital C-suite leaders and thought leaders from hospitals, and all of them have actually come here today to discuss the challenges that India is facing with regard to healthcare today, and also to discuss about the advancements that have happened in technology. Digital technology has actually proliferated and advanced so very fast, and the objective of the conference here today and the conclave here today is how can we leverage these technologies to ensure so that we can solve the healthcare challenges in India. And a couple of things that are emerging at this point in time. One is not to think point solutions, but to look at the continuum of care, to look at a solution that spans from non-acute care to the hospital and back to acute care. What I mean by that is, how can you prevent a disease from happening? How can you diagnose a disease in an early stage? How can you manage a chronic disease, not in the hospital, but manage the chronic disease at home, so that you actually reduce the cost? There are a couple of things that actually have emerged as areas where there can be a lot of support from the other stakeholders in the ecosystem. There is a scope for becoming a little more regulated, because there is so much proliferation of new apps, new devices that are coming in. Are they providing quality healthcare? Somebody needs to check it. There has to be a system that needs to check it. The second, the biggest driver for prevention is awareness. So is it possible for a huge awareness agenda which is driven right across the country? Yeah, that's another question that which we're actually discussing today. But after all, third, how can we leverage the startups? Because they are the ones who have their feet on the ground. They are the ones who are actually connected to the last mile. And that's what we are actually trying to do at Philips. We have the new Health Suite digital platform, which is a cloud-based platform, which allows any third-party devices, Philips devices, applications, which can actually extend the solution right from prevention to home. And today we're going to have a couple of startups, not a couple of startups, I think about 10 or 20 startups here in Bangalore, actually hacking and creating new apps on this new platform over the next 24 hours. Exciting day. Let's see what comes out of it. And we have launched a new digital accelerator at PIC, the Innovation Campus in Bangalore, which is going to facilitate bringing all these stakeholders in the ecosystem. Wonderful day, energizing day.
So what are all the other projects Philips is coming up with, along with actually healthcare?
So there are three things. There are several things, but let me pick up one or two. We recently launched the ECG. It's called the Efficia ECG 100. What this ECG does is, it's ECG in a palm. It's the size of your mobile phone. Invariably when a person says ECG, they say there are so many ECGs in the world, right? But this is very unique because it's diagnostic quality. Diagnostic quality ECG, whereby this ECG can be very easily used. It's got only two buttons: power on, take ECG. And even a A&M worker or a nurse or a Unani doctor, an Ayurvedic doctor, a physician, anybody can use it very, very easily. It automatically takes the ECG, it encrypts it, because privacy is actually very, very important. And it sends to a cardiologist anywhere in India or anywhere in the world. And you can actually get the advice and diagnosis within a few minutes, which can actually help save lives. So this just to give you an example of one such example that's happening. A lot of nice things that are happening at the Innovation Campus. So there are several challenges in India, right? Instead of getting into the projects, there are several projects that are going on. But if you look at the problems that we are trying to address, is the challenges of looking at how we can come up with solutions. Again, I go back to solutions. It's not products. How can we connect the different stakeholders in the ecosystem in the several chronic disease areas like cardiology problems or pulmonary problems or looking at oncology, and how do we look at different use cases working with the clinicians in the hospitals and with the startups in the ecosystem to be able to actually come up with new ideas and solutions. You don't need to actually sit down and create a new product every time. If you just look at the number of available solutions that you have, if you actually connect it in a meaningful way with the clinical expertise behind it, it can make a huge difference to India and the medicine society.
Digital technology and emerging mobile technologies, and fundamentally create more affordable and targeted healthcare delivery solutions to the consumers at large. So basically the way that we see it, I think this roundtable also came up with the very targeted solution that the future of healthcare for India is to look at convergence of what we have in the form of mobile technologies today and in terms of the platform that is today available. And Philips has got this great platform, which is a digital platform on which they are now wanting to add a lot more startups into it. I think that's a great opportunity. So I think what we have as one of the biggest opportunities is basically to look at how the startup ecosystem in India can come onto their platform and create new innovative and disruptive technologies so that healthcare in the country can become more affordable, can become more accessible, and at the same time can become more preventive in nature. Because what India requires is quick solutioning. What India requires is a new national agenda on making healthcare as the front runner for all our reforms. And healthcare and reforms in healthcare can actually add a lot more to our GDP. So we're working with Philips on the entire COPD area. We believe that in the home healthcare space, and that is the space in which we are. Nightingale's is our home healthcare company. So we are working with Philips in terms of the entire COPD management at home, and it is working very effectively. So a lot of patients, and particularly in Bangalore city, there are a lot of patients who have pulmonology issues. So we are working with Philips to actually help them to deal with their pulmonology issues at home. And that is one of the projects that we are working on, and we will work on many others. It's important to sort of ensure that each one of us does our own bit for our own health. We cannot look at just the external environment to do things for us. I think today we have the opportunity and we have the platforms on which we can look after our own health. So preventive healthcare is a very important agenda, and each one of us as Indians should basically start preventing our own health. Thank you.